Good morning, I'm AZIZAH, a student at the Faculty of Medicine, Gadjah Mada University. And this time, I will present the result of my research entitled Validity and Diagnostic Performance of the MNA-SF against the GLIM consensus in hospitalized older patients at dr.Sardjito Hospital, Yogyakarta. Science is developing over time. It is common that the MNA-SF is used as the gold standard for early detection of malnutrition, especially in elderly hospital patients. And recently, consensus GLIM emerged as a diagnostic framework from diagnostic malnutrition. This study was conducted to assess the validity and diagnostic performance of the MNA-SF against the GLIM consensus. This is important because the use of appropriate screening tool is one of the attempts to determine the incidence of malnutrition correctly, so intensive treatment can be carried out for the patient recovery. This research used a cross-sectional study design involving 160 patients aged over 60 years who were hospitalized at Sardjito Hospital. MNA-SF screening is carried out in the first 24 hours hospitalization using 6 indicators, and the diagnosis is carried out by assessing the indicator phenotypic and etiology criteria of GLIM consensus. Eventually, MNA-SF diagnosis test to GLIM consensus conducted by assessing the validity and diagnostic performance. In this study, it was found that the prevalence of malnutrition using MNA-SF was 82%. It is higher than the prevalence of malnutrition with the GLIM consensus, which was only 77%. It can be seen in the validity test result that the sensitivity value of the MNA-SF to the GLIM consensus was 96%, which interpreted that it has a good ability to show which individual will suffer malnutrition for the entire population who are truly malnourished based on the GLIM consensus, while the specificity was 65%, which interpreted that the MNA-SF had moderate ability to show which individual were not malnourished from the entire population who were truly not malnourished based on the GLIM consensus. Furthermore, in this study, the result diagnostic performance using the AUC obtained a calculation of 0.8 that indicates that the MNA-SF has a good diagnostic ability based on the GLIM consensus. Likewise, with the result of the kappa coefficient analysis was 0.6, it is interpreted that the MNA-SF with the GLIM consensus has good agreement in diagnostic malnutrition. From this result, it can be concluded that the MNA-SF is a sensitive malnutrition screening tool, but the MNA-SF have moderate specificity for diagnosing malnutrition based on GLIM consensus. So the GLIM consensus still needed to confirm the diagnosis of malnutrition for elderly patient population. Thank you.